So sleep apnea, as the name indicates, is stopping breathing during sleeping. So this could be partial stopping of breathing or complete stopping of breathing. Now, the word apnea, which is a technical term, means stopping breathing. So you know what sleep means. So sleep apnea is stopping breathing when you're asleep, and like we said, it could be partially stopping breathing or completely stopping breathing. So sleep apnea broadly can be of two different types. It could be obstructive sleep apnea, when the breathing tubes collapse and close up during sleeping, and hence there is stoppage of airflow. The other reason could be what is termed as central sleep apnea, where the signals coming from the brain, that is the sleeping center, to areas in the lung do not get activated, and hence there is no airflow through the nose or through the mouth. So one is a central mechanism which is in the brain. The other, which is more local in the breathing tubes, is called obstructive sleep apnea. So OSA is a common disease that normally happens in people who are overweight or obese. This is a condition where the airways are intrinsically collapsible. So what does that mean? It means that when the muscles of the body are relaxed, like is the case when someone is sleeping, the airways tend to collapse inwards and causes narrowing or closure of the breathing tubes. And hence, the flow of air from the outside to the inside ceases, stops for a few seconds. Now, when we say for a few seconds, this could amount to anywhere between 15 to 30 seconds. In some cases, this stoppage of airflow could be as much as a minute or even more than that. However, what is important is that this happens again and again through the night. So you go into a cycle where people start snoring, and I should have said before that snoring is an important component of sleep apnea. So generally people who do not snore would not get sleep apnea. So you start snoring, then the snoring becomes louder, the airways collapse even more, they close up completely, airflow and hence oxygen flow stops for a few seconds. The brain tells you that you have to wake up. If you don't wake up, then the breathing tubes won't open again. So the breathing tubes open, the air flows in, the person starts breathing again, and then the whole cycle gets repeated. So you have even patients who do this once every minute throughout the night. So you understand that there will be certain people who will actually be deprived of oxygen. So the vital organs like the heart, the brain, the kidney and so on will be deprived of oxygen for as long as maybe a third or even half of the night. So various organs in the body like the brain, the heart, the kidney, the liver are deprived of oxygen, and hence all the organ manifestations, the system manifestations of sleep apnea, which I am sure we'll discuss in a few minutes time, will be manifested in these individuals. So patients in sleep with sleep apnea, unless it's corrected, unless it's treated, die early in their disease process. They die, they have a shortened lifespan and they die early, which is why identifying and then treating these people becomes so very important. So there's a couple. So I think if you talk about sleep apnea, it is better to think about symptoms that happen during sleep and symptoms that happen during the awake state. So usually the partner, be that the husband or the wife, will complain that a person snores loudly at night. However, if they're observant, they'll also tell you that along with snoring, there are periods when there is absolute peace and quiet. There is no sound emanating at all. So those are the periods which is the apnea, when people have stopped breathing and the various organs are deprived of oxygen, right? So the main symptom is snoring. However, the more important pickup is when the bed partner comes and says that he stops breathing during the night, there is quiet during the night, that is a symptom of apnea. However, people are also restless at night. So people who have sleep apnea tends to toss and turn more. Some people would kick and move their legs on a regular basis. Some people might even walk around in the middle of the night. So there are other manifestations of sleep apnea which happen during the night, during the sleeping hours. However, from a patient perspective, what is more important is what they do when they are awake. So when they are awake, because they have not slept well, the sleep has been partial during the night, they try and catch up on their sleep during the daytime. So during the daytime, they feel sleepy, they feel tired, they feel lethargic. Some people would complain of loss of memory, lack of concentration. People who are working tend to have reduced work performance to the extent that some people would describe loss of multiple jobs because they are unable to concentrate and they are unable to remember in their work environment. Some people would be tired, depressed, irritable, and depression again could be one of the sole manifestations, the only manifestations of sleep apnea. The other thing which is interesting is that the symptoms and the signs seem to be slightly different in men and women. So in men, it's a disease mainly between the age of 40 and 50. In women, it is mainly after their period stops. So it's mainly after menopause, which would be about 50 to 60. Again, in men, you have the classic symptoms of sleep apnea. And what do I mean by classic symptoms? So by classic symptoms, I mean that people are tired, sleepy, and somnolent during the daytime. During night, they snore loudly. In women, it's more of other symptoms, the lack of memory, the lack of concentration, feeling irritable during the daytime, being depressed during the day. They could be the only manifestations of sleep apnea, and hence, in women, the pickup rate, the chances of diagnosing the condition are lesser as compared to what it is in men, and you have to be even more conscious in thinking about sleep apnea when women with these symptoms come and present to the doctor. So that's the greatest problem. So I think what we have spoken about is the symptoms that either the bed partner complains of or the patient complains of. However, the most important symptoms of sleep apnea are when the organs are deprived of oxygen. So we said before that people who have sleep apnea die early, and they mainly die from heart attacks and strokes. And when I talk of strokes, I talk about brain strokes. So they tend to bleed within their brain, or they have loss of blood supply to certain areas of the brain. So heart problems other than a heart attack are rhythm problems. So some people may have heart rates which are fast and irregular, what in medical terminology is termed as atrial fibrillation. Some people might just have chest pains in the form of angina, and some people will go on to have heart attacks. People tend to have uncontrolled blood pressure. So if you have someone who has multiple medications for blood pressure but is still not being controlled, think sleep apnea even if they are not overweight or obese. Because there is a certain percentage of people who will have sleep apnea despite being thin, not being overweight or not being obese. So that's something worthwhile remembering. The same stands true for diabetes. So if you have someone who is on insulin, who takes tablets, but has still got uncontrolled diabetes in the way that their blood sugars are raised or their glycosylated hemoglobin, the HbA1c is persistently raised, think whether these patients might have sleep apnea or not, or do a test to find out whether patients have sleep apnea or not. So the diagnosis of sleep apnea is first from taking a history. And there are certain protocol-based ways of taking the history. So there are different questionnaires. One of them is called the Epworth Sleepiness Score. And this is a questionnaire which gives you a score based on how sleepy you feel during the daytime. And it mentions various activities like sitting in the car or just sitting during lunch or in the middle of a conversation, which might actually make you fall off to sleep. It's an easy thing that you can actually answer yourself, and it's freely available on the net. So if you Google Epworth Sleepiness Score, it's something that you will easily find online. The other questionnaire, which is quite easy, is something which is called a stop bank questionnaire, which looks at various other objective measures like blood pressure, like the presence of observed apnea, that is stopping breathing, and so on and so forth, which also gives you a score and tells you whether you're at a higher risk of having sleep apnea or not. However, these are not robust indicators, but only increase your suspicion of sleep apnea, or maybe the doctor's suspicion of sleep apnea. The most holistic way, the recommended way of finding out about sleep apnea is to do a polysomnography, which is the technical term of recording a sleep study through the night. So when I say recording a sleep study, what does that mean? What do you do? So during sleep, you record various measures. And these measures including recording the brain waves. So it records how you're breathing in the various stages of sleep. We record the heart rate, we get an ECG tracing done. We look at airflow through the nose. We look at expansion of the chest and the abdomen. We look at twitching of muscles, how twitchy the muscles are during the night, how much the eyeball moves during the night. And sometimes you could have in good centers even a video of how people behave during sleeping hours. So a polysomnography or a sleep study is the most robust way of trying to find out whether someone has sleep apnea or not. So the first and most important risk factor for OSA is obesity, like we have said already. So being overweight would be by far the most important factor. The other factors would include the various metabolic parameters that we just mentioned. So we mentioned things like diabetes, hypertension, etc. So while these are driven by sleep apnea, people who have these metabolic parameters which are uncontrolled, that also might increase obesity and worsen your sleep apnea over a period of time. Lack of exercise increases the risk of obstructive sleep apnea because it increases the risk of obesity. So any factor which increases the risk of obesity also increases the risk of obstructive sleep apnea. Airways diseases, asthma, COPD for instance, go hand in hand with obstructive sleep apnea. So if you have obstructive sleep apnea, your chances of having uncontrolled asthma or uncontrolled COPD is higher. And again, if you're breathless, then you exercise less, you're more obese, and hence the risk of obstructive sleep apnea in these individuals is going to be greater. So by far, the best treatment option for OSA is a machine which is called CPAP. So CPAP is the abbreviation for continuous positive airway pressure. So you have to understand what exactly that entails. So continuous positive airway pressure is a mechanism, a simple mechanism by which a machine delivers air through a mask which splints the airway open. So we said that during sleeping, the muscles are collapsible and the airways close up. So if that happens, then you understand that there will be cessation, there will be stoppage of flow of oxygen to the various vital organs of the body. What the air does is to splint this airway open. So this closed airway, air goes in, it splints the airway open and keeps the airway open throughout the night. Now you have to understand that this requires the application of a certain amount of pressure. The air delivers the pressure which comes out of the machine. Again, you would understand that the depth of sleep, how fast you're asleep, will vary depending on the stage of sleep. So when you're sleeping early on, the depth of sleep is less. Later on in the night, the depth of sleep is going to be greater. So the pressure required to keep the airway open is going to vary at various portions of your sleep cycle. Hence, if at the initiation of sleep, as an example, you need 6 centimeters of water to keep the airway open, when you're fast asleep, you might need something like 18 to 20 centimeters of water to keep the breathing tube open. Hence, we have moved from what used to be called manual CPAP machines, where you delivered a fixed pressure to the airway, to what is now called an auto CPAP machine. So the amount of pressure that is needed is actually something which the machine predicts and delivers depending on how fast asleep you are. So this machine is intelligent enough to deliver say 6 to 8 centimeters of water when you start sleeping, and maybe 18 to 20 centimeters of water when you're fast asleep. So it doesn't give too much or too less, and hence patients tend to comply better. They use the machine more because they're not getting too much of pressure and feeling uncomfortable, or getting too less of pressure, in which case the sleep apnea is not getting corrected. So now we have moved away from manual CPAP machines, and in most cases, if not all, we give auto CPAP, which is by far the best treatment for sleep apnea. And when I say by far, I mean by a long distance. There are other treatment modalities available, but they are mainly for the very mild obstructive sleep apnea category, not for the moderate and severe. So what are the treatment options are available? So sometimes you have treatment options where you can increase the diameter of the airway by doing surgeries which pull the jaw forward. Sometimes ENT surgeons get rid of some of the soft tissue at the back of the neck, or maybe if there's a deviated nasal septum, they try and straighten the nose and hence reduce obstruction. However, you have to remember that these are more treatments for snoring rather than being treatments for sleep apnea. And these surgeries are generally mutilating, and if you have this surgery often, if they don't work, then you would not be able to have CPAP after. So it's got dual disadvantages: A, the risk of surgery, and B, if it doesn't work, the surgery does not work, you end up not being able to use the CPAP machine in certain cases. So again, I think bottom line carry home message, do try and use the CPAP. It is uncomfortable when you start using it for the first 10 to 14 days, but I often liken using CPAP to wearing glasses. When you start off, they feel uncomfortable, they slide down the nose, they cause a cut on the nose, you sometimes sit on it and break it, but after a period of time, you get so used to it that you have to actually got to touch your face to make sure that you're wearing it. So like you wear glasses when you're sleeping, when you're awake, CPAP is the machine which would correct your sleep apnea when you're asleep at night, and you would get used to it. The amount of benefit you get, not just in the way of controlling the metabolic parameters like diabetes, hypertension and so on, but also the daytime symptoms like tiredness, lethargy, sleepiness, lack of memory, lack of concentration is huge with auto CPAP. So with continued use, all these parameters will gradually get corrected and your life will change. You might even end up losing weight because you're much more mobile, because you don't have the tiredness and lethargy during the daytime. That's a very important question, so something which has been looked at in the West and is often missed at in our country. So, these heavy goods vehicle drivers, the lorry drivers, they drive for hours together without taking adequate rest. Sometimes they're obese because they don't have the fittest of lifestyle. They don't exercise, they don't get the time to. So often these people have undiagnosed sleep apnea and they drop off to sleep while they're on the wheel driving for long hours. And without realizing, they crash into other cars or they crash into dividers between roads and so on, and hence cause accidents. So in the US, I have talked about heavy goods. It's not very different for light goods vehicle. The reason we talk about heavy goods vehicle is because they can cause far more damage as compared to the private cars you see. But irrespective, a lot of vehicular accidents in the US, they feel the greatest reason is obstructive sleep apnea. I don't think our people are any different. It's just that we don't have the studies. Our lorry drivers probably cause an equal amount of damage, if not more, but we don't have enough understanding and recognition of the condition to try and screen these patients for sleep apnea. And I believe that is something that the government should do at their own level in screening people and reducing the number of road traffic accidents. I think we have discussed most of them. I think talk about it in three different categories. The most important harmful effect is the one which the patient or the family does not notice, which is the hypertension, the diabetes, the heart disease, the kidney disease, the brain disease that these people suffer from. What patients observe is the tiredness, the lethargy, the lack of memory, the lack of concentration during the daytime, which even entails the loss of working hours or even translates into people losing their jobs because they can't do it properly. However, the facet which the bed partner, like we said, observes is the loud snoring, which keeps her awake or keeps him awake, but also the fact that they stop breathing during the night, which is a symptom or a sign which the partner talks about when they come to clinic together. So again, I think we have talked about this at length. So I think there is an established correlationship. It starts off with uncontrolled high blood pressure or hypertension. It manifests as ischemic heart disease, so it might manifest as angina, going up to heart attacks, which might increase mortality. It might increase the number of deaths from obstructive sleep apnea. It can also manifest as rhythm problems. So atrial fibrillation we spoke about a little while ago. So it can happen that atrial fibrillation, the heart rate, does not get corrected in spite of medications because the patient has uncorrected obstructive sleep apnea. So I think the important things about sleep hygiene, which is true for everyone, not just true for patients with obstructive sleep apnea, is to go to bed at a reasonable time. So when I say reasonable time, you're talking about something like somewhere between 10 p.m. to 11 p.m., something of that nature. Make sure you do not look at bright objects before you go off to sleep. So you should not be looking to your computer or on your telephone or your tablet before you go off to sleep. You should not be watching the television before you go off to sleep. You should not be taking any stimulant drinks like coffee, tea for instance, within 3 to 4 hours of going to bed. Neither should you be taking things like alcohol, which cause a change in the sleep center just before you go off to bed. The same stands true about sleeping tablets. Sleeping pills alter your sleeping rhythm and it does not ensure good quality sleep. So again, if you can manage, you should avoid sleeping tablets as much as possible. A walk is very good early in the morning, but a walk just before going off to bed is not such a good idea, but because it tends to alter the sleep cycle that you have. So walking is good, but maybe not just before going off to bed. So those are a few of the things which would be good sleep hygiene in my book and should be practiced by everyone. So it's massive. So we don't know in our country, but I guess if you look at the population today and the fact that obesity is increasing, we are probably looking at about 1 in 10 to about 1 in 15 people having undiagnosed sleep apnea. And you have to take into account that it is not just the obese individuals who have sleep apnea. You have to add a percentage, a small percentage, but still a percentage of people who look normal, who are not overweight, who also have sleep apnea. So I guess you're looking at very large numbers here. And the people who are watching this, a few of them I'm sure would feel that they have the disease process. So if there's a room sat with 10 to 15 people in it, there'll be 1 to 2 people in that room who have sleep apnea, which has probably never been picked up. It's as common as that.